Welcome back. We're discussing the latest advancements in dental implants with Dr. Pil-Sung Kim. Now, there's so much I have to cover. We have such a short time, but I want to talk about people with dentures. Now, with implants, you can do all kinds of things, but what about for a denture wearer, somebody that's nervous about their denture popping out? You know, they don't talk, they cover their mouth, they do. What can you do for them with implants?
Actually, implants started out try to help out the edentulous people. If you look at the statistics about age over 65 years old in this country, 1/4 of them are edentulous, total edentulous.
And that means that they have total dentures.
Yeah, total edentulous. So it means that a lot of people are walking around without any teeth, and means that they're with the dentures. So those dentures are not locked in, and they're flying all over the places in their mouth.
Do you think that socially speaking, people tend to pull back because the dentures come loose, they fly out? I mean, we all laugh. We see it on TV.
Definitely.
But it has to be traumatic.
Yes, it's dramatic, actually. Because of that, they tend to shy away talking to people. They tend not to smile a lot.
Does it affect their ability to eat all the foods?
Sure, all the foods, and at the same time, nutritional factors, and all these other things. I mean, their social life is, in danger also. So putting implant and secure their dentures with minimal implants, and will help them. Will help their self-esteem.
When you say minimal implants, what do you mean? Can I secure it? Do I need 5 or 6? How many? I just want to make sure my denture, I can talk without it flying out of my mouth.
Well, use traditionally minimal 2 implant on the lower,
okay,
and 4 implant on the upper for overdenture.
Okay, because that's because the upper is the softer bone.
Softer bones. But depending on the situation, always depending on the patient situation. Sometimes you're not going to believe this one, but with 1 implant, patient will be happy, and we may lock in.
You know, you told me that, and I interview doctors all over the country, and most of them, it's same day, same thing answers.
Right.
They most say all do the same thing. When I talked to you, one of the things that really impressed me about you was you're doing implants, so you went to Sweden to learn. You just got back from Korea, from traveling to go something and learn something there. You make it a big part. We talked about educational hours.
Right.
The average dentist
important.
is required to do 50 hours every 2 years.
Right.
That's 25 hours a year. You told me you average 400, 500, 600 hours a year.
About probably 400 hours.
Plus you're traveling the world to find out
yes.
what's going on. You did 1 implant for a lady who obviously under normal circumstances wouldn't have been able to do anything.
Right.
Is that why you do what you do, so that you can give people that don't have a chance, who think there's no option for them, something to hang on to?
Yes.
So you put 1 implant in, and now what will that do for her with her denture?
Just at least, that gives the support, retention for the denture she's wearing. Actually, she wore the upper full denture, so she doesn't have that much of force exaggerated on the lower denture. So it helps her at least that it's not the force itself, it's the tooth is, the denture will be staying there, not hanging loose.
So 1 implant, put it in, she can put her denture back on it. What is the thing that, and again, I want the untrained, and I don't mean untrained in a bad way, I mean a general dentist. You know, I interview them, they tell me, oh, I do implants. And I say, oh, well, what else do you do? I do veneers. Oh, well, what else do you do? I do, cavities, I do cleaning, I do this, I do that. Obviously, there are some risks, and I didn't realize it until I talked to you. The risk isn't getting the implant in right. The risk is there's a nerve that runs, there's a blood vessels that run,
small cavity.
You know, there's a lot that goes on there. How does a general dentist that's placing implants, because they're all starting to place them, how does he find the time to do all the proper study, to do everything, to be able to have the same level of competence, for lack of a better word, as yourself or someone like you?
Well, obviously there are so many general dentists who is talented enough to help their patients out by placing implant. There's no doubt about it. All those general dentists are doing it. But the thing is, generally, I would ask you the same question. Like in medicine, you have family doctors around, and would you put your wife or your mom is going through heart surgery? Would you let them do it, or your heart surgeon to take care of you?
So you're saying, but letting my general family practitioner do heart surgery on me, it would be about the same thing as having my general dentist put in an implant?
Well, not the same analogy, but generally I would say you want someone who's specialized in, who had a special training, who's well capable of dealing with all these complications if it happens.
Right.
Rather, you want some, depending on some practitioners who believe that they could do everything on their own. I mean, I would say generally, I'm believing in teamwork. I'm working with the
Yeah,
good
it was
general
something that
dentist.
impressed
Yeah.
me about you.
Yeah.
You seem to have put around you a very strong team of people to
Right.
cover just about everything.
Right, yes. You work as a team. Instead of one doctor doing everything versus if you have a good team working together, a couple doctors working together, which one would you think is the best quality of service you can provide for your patient?
Okay, and this is why I had to have you, because your mindset is so different from most. Most people want to say, I could do everything the best.
Mm-hmm.
You tend to focus on, this is what I do the best, and I need to offer the best service. I have to have somebody to my right or somebody to my left that can
Sure.
offer that, so that as a team we're much stronger than as an
Right.
individual, and we can provide people more options. I want to talk about securing dentures. 2 implants on average is normal.
average is
on
normal,
the one you
yes.
did was a special case.
Right.
What else can you do with implants? Now with 2, do I still have to take them out and clean them?
Yes, Joe.
Okay. What else? Can you actually secure? I don't want to...
Yeah, if the patient have enough bone, if they don't, possibilities that we can build a ridges, we call it augmentation. So we build the bone there and then place more implant, 4 to 6, or up to 8 or 10. The more the number, better, and we can secure the teeth in there. Actually, it looks like their own teeth.
And is it as strong as their own teeth?
Right, probably stronger.
Really? They can chew steak, they can chew... So
Anything
somebody
they
wearing
want.
dentures maybe hasn't had them real long, 3, 4, 5 years, so the bone hasn't absorbed too much.
Right.
They can actually lock that denture in. They can have the same chewing...
They don't have to remove them.
They don't have to remove it. They leave it in. All right, let's take a look at this next picture, because this gentleman, if we look at the picture, he's got 5 or 6 good teeth up front on the bottom. I don't know if they're any good, but they're still there.
Oh, there were problem teeth, actually.
Yeah, well, and on the top. Now, he cannot chew anything.
Right.
To me, he has nothing on the bottom to squish to
Right.
chew against.
Besides, he couldn't wear dentures because denture make him gag. Because there's some people,
That was something you told me about, that people put their stuff in their mouth.
and they cannot stand it, so they start gagging, so he cannot even wear dentures.
All right, so what'd you do for him?
So we placed 4 implant on the bottom.
Okay, now, when
As
we
you
look
can
at the
see.
after picture, I didn't realize when I first looked at this, I thought that that was plastic or something along the bottom of the denture. You've pulled his lips down so that we can see
Right.
that that denture is rounded, fixed, and fitted. That is actually permanently screwed into his
Screwed
jaw.
in, yes.
It is never going to go anywhere.
No.
Now, the next one I want to look at, I have to tell you, how would you walk around with that in your mouth?
Well, amazingly, there's
Do
so
you,
many
do you think
people
people are embarrassed that it's got to that degree?
Uh-huh.
And they
They're
don't
also
recommend?
embarrassed coming to see doctors because their mouth condition is so bad. I mean,
Can you fix this without it being painful for him?
oh, yes, we could. I mean, we can deal with their anxiety. We have anesthesiologists on our access, so if patient wants to be
So
knocked
what
out.
did you do for this guy?
We took all these teeth out, and actually on his upper teeth area, he had a sinus problem. There is no bone, actually. We had to do, we call it bilateral, both sides, sinus grafting, and we placed 8 implant on the upper.
Now, that is something that a general dentist is not going to do.
Not most general dentists don't.
They might
There's
try,
some-
but
yeah.
they really probably shouldn't.
Right.
Okay, so you take that out, you rebuild the upper, you
Yes.
rebuild everything for him, and now those teeth are they're locked in.
They're locked in.
I know there's people at home who are going to have questions, they're going to have concerns. I hate to put you on the spot, but if they do, can they call you?
Sure, anytime.
All right, final thought, one thing you want people to remember.
You'll be amazed how people change after they've done the implant and periodontal plastic surgery, because they gain their self-esteem back and they walk around and they are a totally different person. You see them change. It's amazing, and that's the reward.
Is that one of the biggest rewards of your career?
Yes.
Dr. Kim, I want to thank you for coming in on the show. You've been extremely informative. I'll have to have you back.
You're welcome.
You've been watching Medical News Network. For more information on this subject or any other, please visit our website at medicalnewsnetwork.info. For now, I wish you good health.